Wednesday today.
Awesome. Hanging in there.
All right. So we are the San Antonio Family Support Collective, and we are putting together an online workshop series called Thriving Together. It is going to be every Wednesday at 4, Thursday at 8:30, and Saturday at 2 p.m. So follow along with us and get some updates. We're going to just introduce ourselves really quick. So, Dr. Holly, do you want to start?
So hi, everyone. I am Holly. I am a pelvic floor physical therapist, owner and founder of Lotus Rehab, which is a holistic physical therapy practice in San Antonio. And I have my doctorate in physical therapy, and I have such a passion for women's health and empowering women and providing education and awareness when it comes to the pelvic floor. After my own experience with having babies and realizing, even as a PT, sort of missing a whole lot of this information as it pertains to the pelvic floor, I've just really found myself called to provide that education and awareness and have these conversations so that we go into pregnancy and the postpartum period feeling and not having people come in my door and say, like, why didn't anybody tell me? But instead sort of changing the dialogue in a way of, hey, this is what's going on, and knowing where to find those resources. So it's my passion and my mission to just provide that awareness for women. So that is me.
Yes, and we're so glad you're here.
Thank you for having me.
Yeah. So I am Blanche Schuchardt. I am a fitness professional. I'm a certified personal trainer and certified pregnancy and postpartum fitness coach. I fell in love with all things birth through the birth of my first son. And I had 3 babies in 4 years, which is a lot, and I learned a lot. But throughout that time, I just remember looking for people who could coach me through this as it relates to fitness, and I could just never find anybody who was qualified. There's tons of people who I loved dearly that, I would work out at their gym or whatever, but it would be on me to know what I could and could not do in the season. And so I just decided to be the coach that I never had. And so I started doing an obsessive level amount of research, and I obtained multiple certifications. And yeah, so I love all things outdoors. I would totally rather be outside. So this rain is kind of like want making me sad. I love succulents. I'm an Enneagram 8 wing 7, if that's your type of personality test. But yeah, I am so glad to be here, and I'm such a birth advocate and creative in general. Love to create things. So we are glad you are here, and we're going to move on. So today we're going to be talking about sustainable fitness. This is just kind of the, I forget what this is called every single time, table of contents of how the workshop is going to go. All right, so before we dive into sustainable fitness and fitness at home, I just want to share and encourage that there's no timeline to transition into at-home workouts. There's been a lot of changes in the last few weeks with COVID-19 and people transitioning to being at home full time. And so they're working at home and they're parenting and schooling their children. And there's a lot happening. So first and foremost, I just want to encourage you and give you permission to be present with yourself and grieve if you need to grieve, process all that has happened. I also just want to encourage you that movement may be therapy for you in this time, and it also may not be therapy. It might feel overwhelming, and both are okay right now. So you're not going to, quote, win anything long term by diving into fitness and neglecting your whole health. So we just really want to, give yourself permission to be wherever you are in this moment. And so one other thing is just we need to be mindful to not overstress an already stressed system, especially in times of trauma or transition. And so, this being a time that can be very traumatic for certain individuals and also is a transition for everybody, we are holding more stress in our system than we do on any other like average day or average March. And so, yeah, we just need to be mindful of how we are moving, and we don't really want to overstress a system that's already holding stress. And so, welcome to people who are just joining us. We are about to dive right in to the portion of the at-home fitness. But before we begin, Dr. Holly, did you want to add anything?
I don't think so. I think everything that you said, I totally agree with. You know, giving yourself permission to meet yourself where you are during this time. We'll talk a little bit more about how that relates to the pelvic floor as we sort of move forward through this webinar. But yeah, I think just piggyback off of that, like meet yourself in this time and be kind to yourself. And if things feel good, go with it. And if they don't, you know, modify or seek out resources that might be helpful for you during that time to kind of troubleshoot through what's working and what's not working.
Yeah, that's awesome. Okay, so we're gonna dive into some different we really want to focus in on the different mindsets towards fitness. And so I want to start at the very beginning and just ask where your body is at. What is the state of your physical condition? Have you been sleeping well and eating well and moving well? We really want to get the basics down in this area. Also, have you been moving consistently, or has there been like a significant hiatus? Are you jumping back into fitness? Like you've been not working out for 4 to 6 weeks, and maybe you find yourself having a ton of downtime and you're wanting to work out again. Or have you been working out really consistently and you're just transitioning to working out at home versus the gym? These are all things to take into consideration. The next thing is, what are your goals? So I really want you to ask yourself the question of, what do you want to accomplish and why are you wanting to move your body? There's not necessarily a right or wrong answer, but I want you to be mindful of what is your reason, what is your quote why. It can be hard because you may, if you're like really into fitness, if you're a fitness enthusiast, it might be difficult in the sense of having to let go of certain goals you had during this transition. And I just want you to say that, I just want to say that that is totally okay. A time of transition is a great opportunity to actually start fresh with our goals and desires. Your goals can look similar to what you had before, but you may need to let go of expectation of how you accomplish the goal. It may not happen as you thought. So start from the beginning and look at your life today, not what it was a couple weeks ago before all of this happened, but today, and think critically about your capacity, your time, your focus, your season, and your body. So I don't want us to be afraid to adjust the goals as we move forwards. It's okay to grieve the letting go. And maybe you're not a fitness enthusiast. Maybe you are wanting to start working out, but you don't necessarily have any goals that you're needing to let go of. So we're going to just go over quickly making SMART goals. So you may have heard this acronym before, but it's specific, measurable, attainable, relevant, and timely. I want you to break down each goal according to these indicators. It should be specific and measurable, so you know if you have achieved that goal. And it needs to be attainable, right? So make a goal with the body you have today in mind. Is the goal relevant to your desires? Don't just pick a goal because you think that's what you should be doing, but rather pick one that you really want to crush. Pick one that resonates, right? So as an example, if you want strength, pick a goal that will ensure that you're getting stronger. This may be hard if your goal is just like to have fun, right? Or maybe your goal was like to have fitness in the midst of community, like you loved going to group fitness classes. really take the opportunity to figure out why you're moving your body. So if you loved going to group fitness classes, what about that was fun to you, or what about that drew you to that experience? Okay, so lastly, we make sure that it's timely. It can be by a certain date, or it could be within a certain time, but this kind of goes with the measurable. So an example is you could like have a goal of do a pull-up by October, or move 4 times a week. So those are 2 different types of time indicators or requirements, if you will. And lastly, we're going to talk a little bit about progressive overload in planning. So in order for muscle to grow, this is the progressive overload principle. We're going to dive just a little bit into science. One second. We're going to approve some people. Hello, welcome. For those who just joined the meeting, we're so glad that you're here. We are talking about at-home fitness and some sustainable strategies to work out well from home. So we've talked about checking in with your body. Where's your body at going into working out and going into fitness? And we've also talked about what your goals are and how to plan and to goal setting well, if you will. So now we're going to move into progressive overload and discuss the principle of progressive overload. So the principle of progressive overload is in order for a muscle to grow, to strength to be gained, performance to increase, or for any similar improvement to occur, the human body must be forced to adapt to a tension that is above and beyond what it has previously experienced. However, this progress needs to be gradual. That's the key here. We don't want to like deep dive into something if we've been on the shallow end for a while. We just need it to be gradual. And so what I see oftentimes is someone who's wanting to transition back into fitness or start working out from home. They may or may not have specific programs in place yet. And so they just go and do a workout that was maybe similar to the last workout they did. And I think that's just a common misconception, because you did it before, you could do it again, but you also don't have the same body as you did back then. So if it's been a couple months or even years or even weeks, it may put unnecessary shock on your body. So we want to progressively overload and gradually increase the demand that we put on our body. Okay, so, and just a quick note, the market currently is being flooded with free or online programs because of everything that's transitioning, and this is wonderful and maybe also overwhelming, but I just really want to encourage you to vet and research the online and at-home programs if you choose to purchase any. Invest in a coach or personal training if you want specialized training. Your long-term health and wellness is totally worth it, and you would benefit from it as well. If your goal doesn't require specialized training, then you can also just start with a basic training plan that caters to that goal. So we talked about, if you have a strength goal, you're wanting to get stronger. So if you have a strength goal of wanting to do a pull-up by October, as an example, you would plan or basically program upper body movements and core movements and strengthen all the muscles that go into doing a pull-up, right? And we can break down those later on. If y'all have questions, I would love to answer them. But for the sake of time, we're going to move on. The last thing about at-home fitness is basically just checking in with your confidence. Experts say that on a scale of 1 to 10, your confidence level needs to be at an 8 or higher for you to have the most, for you to be able to have the best confidence in achieving your goal, if you will. And so if you are a 7 or a lower, you can reassess the goal and kind of tweak it to where you can bump up in your confidence. And so when you're an 8 or higher, that gives you a great indication that that's a good goal for you in this time. And this is just something, a mantra, if you will, that I have, is just move well and with the body you have today. And I think that's just really important, because in this time, we just really want to move well and love ourselves and love our body and be sustainable with our fitness practices. I love that saying. So now Dr. Holly is going to take off and drop some awesome knowledge on us with the pelvic floor.
I'll try not to go too crazy. You get me started talking about the pelvic floor and I can't stop. No, I love what you said too about the practice and the progressive overload. It brings me back to a quote I say all the time. Practice makes progress, and we have to practice and stress the body in order to make that progress and meet those goals. And so, that just really sort of spoke to me too, in the sense of everything that I tend to do on a daily basis is sort of help people find where they are and then figure out what steps that we need to make to stress the body in a way that works for you and helps you to meet those goals. So I love that. It just kind of brought me back to that practice makes progress, and stress to progress is my other favorite quote that my clients hear me say all the time. So I love that. So we're going to talk about the pelvic floor specifically as it relates to stress, especially as we're talking right now in this current sort of state of events. Many of us are feeling overwhelmingly stressed, anxious, and with that stress, oftentimes we can find ourselves sort of holding muscles tightly and tensely. And this often also includes the pelvic floor muscles, which we don't always think about our pelvic floor muscles being held in a tense state. But the pelvic floor is very much affected by our nervous system. And so when we find ourselves in this sort of tense and stressed state, it will have a direct impact on the pelvic floor, which can oftentimes lead to different symptoms like bladder leaks, pelvic pain, lower back pain, or exacerbation of maybe some pelvic floor dysfunction that we've had previously. And then we find ourselves in this time with maybe some heightened symptoms, and that can almost play into some of that stress and anxiety. And so one of the first things that I just wanted to say and sort of reiterate in this webinar tonight was that if you find your symptoms as it pertains to your pelvic floor, bladder, bowel, core, pelvic pain, or low back pain, that if those symptoms are exacerbated during this time with this high level of stress, that is a normal response for your body. And so we're going to leave you guys with some tips and tricks and things that you can work on in this time to lower some of that stress and tune into this space in order to help you with some of those exacerbation of symptoms. We don't often realize the impact that stress can have on this pelvic floor response. And so I want to talk about a little bit of that today. Basic anatomy, I know, as a PT even, I learned about the pelvic floor, but I wasn't even really that sort of aware in this area. So just talking brief anatomy, and what the pelvic floor is. I always have my little model. I don't know if y'all can see it. I carry it with me everywhere I go. But we've got the pelvis here, the bones of the pelvis. And so the pelvic floor is actually 3 layers of pelvic floor muscle. So we have the most superficial, or the most outside layer of pelvic floor muscle. And then there's a second layer of pelvic floor, and then also a deeper third layer of pelvic floor inside the pelvis. And the pelvic floor,
do you have it right with you?
What?
Oh, did you have it? Show them because I think
okay. Yeah. So if you guys, I don't know if y'all can see my pelvis here, but there's we talk about the pelvic floor and it's sort of a buzzword now, but what is the pelvic floor, right? So it is actually 3 layers of muscle. And so we've got the most outside layer, or the most superficial layer, right underneath the skin that you can see here, that surrounds the vaginal opening and the urethra, as well as the anus, attaching from your pubic bone to your tailbone in the back, and then your sit bones on either side. And then there's a second layer of pelvic floor muscle as well in here, and then a deep layer of pelvic floor that really supports our organs and sits a little bit deeper inside of the pelvis. So there's 3 layers of pelvic floor. So it's quite a complex set of muscles. And the pelvic floor, I like to break it down to make it sort of simple. So the pelvic floor actually is like a huge multitasker, and it plays a role in 5 main areas. So the first area being sphincter function, which includes the bladder, so holding and releasing urine, as well as the anus, holding and releasing bowel movement or flatulence voluntarily. The pelvic floor also supports our pelvic organs, and so that includes the bladder. And I like to always just kind of throw this in here, but I don't know if it's difficult for y'all to follow along with this, but I like my little model. So the bladder sits in the pelvis, the uterus in the female sits in the pelvis, and then also the rectum sits in the pelvis. So I think to understand that this impacts our bowel function, our bladder function, as well as our reproductive function. So it supports those organs. It also plays a huge role in our sexual function. So as it pertains to allowing penetration, whether it's vaginal or anal penetration, it also plays a role in orgasm. And so knowing that when there's this stress response, this can have an impact on our sexual function, pain, as well as our ability to have an orgasm, or even just our overall interest in sex. It also stabilizes the pelvis as well as the low back. Research shows that a large number of women who have low back pain also have actually some pelvic floor involvement. So knowing that if you're having some increase in low back symptoms at this time, it could play a role and be sort of connected in with your stress level and the way in which your pelvic floor is functioning. And then also lymphatic function. So I call it's my 5th S, or sump pump. So if you're having increased swelling or bloating going on, that could also be a sign that maybe your pelvic floor is getting a little bit tense or stressed. And so understanding that the pelvic floor is really a multifaceted set of muscles that plays a role in so many different areas of our life. And as we're in this current state of increased stress, increased anxiety over a prolonged period of time, tuning into your pelvic floor as it pertains to movement, mindfulness, and breathing can really have an impact on our ability to sort of let go of some of that tension and holding pattern.
Yeah.
So I'm also, I don't know if you want to go back to that slide.
Yes. Someone's saying pelvic floor is a boss, Sarah's.
Pelvic floor is the bomb. It is like, so I'm a PT first, right? Like I'm all about the PT in all ways, not just looking at the pelvic floor, but man, the pelvic floor is so cool. It's just so fascinating. I can never get enough of learning about the pelvic floor. And so when we talk about stress, right? Stress, when we have this stress response, what does that do? But it triggers a hormone release that's going to impact our nervous system. And what happens is we can get sent into sort of this sympathetic response, or fight, flight, freeze, which is oftentimes the way it's described, right? So we've got to get our body ready to fight or flight or freeze. And what can happen is the pelvic floor can actually tense up with that fight, flight, freeze response. We'll oftentimes find ourselves getting tight in the chest, breathing a bit more up into our chest. Mm-hmm. And so understanding that our breath plays a role in the flexibility and the ability of our pelvic floor to soften and move. And so this quote here, I love it. The pelvic floor functions optimally when it is supple, flexible, and strong. Yeah. I can't tell you how many people come in my office and they say, man, my pelvic floor is weak. I've got to strengthen my pelvic floor. I mean, but how many of us hold stress and tension and we're trying to do it all and have it all happen? And our pelvic floor actually, I love the hand as an example. Our pelvic floor hangs out in this position. And so then, we think, okay, now I need to really squeeze and lift or Kegel, have a voluntary contraction of my pelvic floor. If it's already in this sort of contracted position or tightened position, when we really need it for, say, a sneeze, or if we're going to pick up our kiddo or run, and we really need our pelvic floor to function for us, what can happen is it's already in this contracted position, and so it doesn't have anywhere to go. So one of the things that pretty much everybody can work on when it comes to their pelvic floor is being able to get our breath down into our pelvis and into our pelvic floor to allow for some of this relaxation and flexibility in these muscles. And if you guys have more questions about that, I can totally go into more detail about it. It's a hard concept. We don't oftentimes voluntarily sort of even tune into our pelvis and our pelvic floor. And so sometimes when somebody says, relax your pelvic floor or lengthen your pelvic floor or breathe into your pelvic floor, it's like, what does that even mean? And so we can go into some of that tonight as well, if you guys have questions on that, and just some mindful breathing techniques about how, and some simple things that you can do that just automatically increase the flexibility in these muscles.
Yeah.
And so when we have that increased stress over a long period of time, what happens is the pelvic floor tenses up, tightens down. We can have increased pain with that, increased pain with intercourse or using tampons, or low back pain because these muscles are here. And when muscles are shortened like this, they also can then become a weak muscle. So over time, you'll get some weakness in that pelvic floor, which can result in some of the really common symptoms that we can experience during pregnancy and postpartum. So some deep diaphragmatic breathing can be really helpful. We'll talk about some of that tonight, on how you can do some of that deep diaphragmatic breathing in order to get some relaxation and mobility in your pelvic floor, which that breathing into your diaphragm, breathing into your belly is not only going to impact your pelvic floor, but your whole body as a system, really tapping into that sort of rest and restore, the opposite of the fight, flight, freeze response, but more into that sort of calming, quieting your parasympathetic nervous system, which can impact your whole body. So being mindful of that and knowing that, as you're moving, just paying attention to, how movements feel, and giving yourself an opportunity to take some time to do some mindful meditation and some relaxation as well as you're doing the movements.
Yeah. That is awesome. Holly, did you want to lead us into just real quick question for clarifying for me? If I have this on my screen, can y'all see Holly? Because if you can't see her, then I want to stop the screen share for a second.
I can't see her.
I think it depends on if she's talking, she'll pop up, depending on the view you have on your device.
Okay, thanks, guys.
Yeah, sure. Technology.
I can try not to do too much like visual stuff, but do more sort of verbal cues and less. I talk a lot with my hands.
No, it's good. Yeah, I want them to see you in the tutorial because I do think it helps. So
yes. Okay, so some deep diaphragmatic breathing. I think that this was on one of those slides. I don't know if you can see it well here or if you prefer it on the slides.
I can get the slide back.
Got a little bit of a glare.
We're learning how to do
this.
So this is
okay.
What she's talking about.
There we go. Okay, so I want for y'all to look at this picture right here and visualize what it is. So you can see it's like a cross section of a body. So we've got the spine that runs along the back and the muscles of the spine. At the top, that's your breathing diaphragm or your respiratory diaphragm at the very top. Then you have your deep abdominal muscles that run from the spine to the front of the abdomen. And then you can see how the pelvic floor connects from the tailbone or the spine into the abdomen. So if you can picture this like a closed canister or like a closed system, or even sometimes picturing it like a balloon can be helpful. So what happens is as you take an inhale, the breathing diaphragm actually flattens or moves downward. So if you can picture that top portion, that top little, what is that? Oh, concave.
Yes,
concave.
I was totally thinking
that top portion of the diaphragm, that sort of top of the balloon, if you can picture that moving down towards the pelvic floor, towards the feet area, as you breathe in, the diaphragm moves downward. And so what that does is when you let your belly expand as you breathe in, all of that air and all of that pressure moves down into your abdomen and also down into your pelvic floor. And I can't tell you how many people tell me that they've been doing this backwards, or even in like mindful breathing or relaxive breathing. We oftentimes think about the exhale as sort of the relaxation component. However, that's not the way that the pelvic floor functions. So the way that the pelvic floor functions is as you breathe in, taking a deep breath in, letting your ribs expand, letting your belly rise or letting your belly relax, getting that breath into your abdomen, you will also help your pelvic floor kind of yields to that breath inward or relaxes towards that breath inward. So if you can try that, place your hands, even one hand on your rib cage and one hand on your belly. And when we're stressed, oftentimes that breath comes right up into our chest and we don't get anything down into the belly. We start gripping our belly. And so I want you to try to take a few deep breaths, really breathing into your abdomen, letting your abdomen relax or soften, letting that breath move down into your pelvic bowl and into your abdomen. And then as you exhale, the pelvic floor rebounds back up and the belly falls back down. So again, inhale. Let your belly expand. Let go of that tension. And then as you exhale, let that pelvic floor come back up and let your belly fall. And this is the way that the pelvic floor is meant to function. This inhale, lengthening, softening, releasing, letting the belly expand. And then exhale, pelvic floor comes back up, diaphragm comes back up, belly falls back down. And don't be surprised if this feels backwards when you first start it, because again, like I think so often we don't think about the relaxation happening as you inhale, letting that breath kind of move all the way down into the pelvic floor. And I think one of my theories of this is that this is one of the reasons that there's such a prevalence of pelvic floor dysfunction in the female population, especially when we start introducing these core changes during pregnancy and postpartum. And so one of my missions is if everybody knew this information about how to breathe correctly, it seems so simple, but it is so impactful for so many people to let go of the tension in your pelvic floor as you inhale. And I want to also give you this that's a great way to relax, but I also want to sort of get your buy-in as well in terms of this inhale, relax, exhale, come back up. If you think about it, a sneeze, a laugh, a cough, so often the primary times in which we have bladder leaks are exhales. Mm-hmm. And so if your coordination is backwards with this breathing, that can have an impact on your pelvic floor and on your bladder for when you are coughing or laughing or sneezing. If you're flipped backwards with this coordination, it's not uncommon that you wouldn't have a sort of relaxation component at the exhale instead of a contracting component at the exhale. So it makes sense. It's just one of those things that we oftentimes don't talk about, and don't teach females the importance that our breath plays. And so sometimes just changing it up in the way of inhale down, exhale up, inhale down, exhale up. Not only will that tap into that parasympathetic nervous system, but it will also help with the function of your pelvic floor in just overall life and health and wellness.
Holly, I have a few questions.
Yes.
I'm really tired, so I'm lying down. But I'm Sarah.
Hi, Sarah.
So is it better to do it lying down or sitting up, or does it matter?
It's going to be easier lying down because gravity is not on your pelvis. So it can be easier lying down. Again, it is such a hard concept, this idea of like breathing into your belly and breathing into your pelvic floor. But if you can visualize it, if you can picture this lengthening, if you can picture those sit bones moving out to the side, I oftentimes even say, picture the vulva opening or expanding. Whoever tells us to relax our vulva?
Yeah.
Like, literally nobody. It's all about, do the Kegels, make sure everything's tense and tight, you're holding everything in. And so if you can just start mindfully practicing this, it will start to get easier. It's just a concept that we've never learned before. So laying down can definitely be an easier position to try this in. Also, if you know how to do a Kegel or a squeeze and a lift, sometimes adding that Kegel at the exhale and then inhale, letting it go, can sometimes just sort of make that movement a bit more dramatic as you start tuning into it.
Yeah, because I wondered if I was trying to try a few different ways, and I don't want it to feel too hard on it, but I was trying to almost feel like I was pushing it out a little bit, or pushing toward it instead.
Yep.
I don't want to down. Stressing.
So we don't want to bear down when we're doing it. And there's actually a really great resource out there. There's a pelvic floor PT that did a ultrasound image of the pelvic floor and the bladder when somebody was breathing up into their chest versus when somebody was breathing into their belly. And so you don't even need to necessarily tune quite so much into your pelvic floor. But if you just let your belly go and let your belly get some air down into it, it will help with the flexibility of your pelvic floor and help with that tension and stress that we're holding in the pelvic floor.
Cool. I'm sad I would miss the other one on breath, Blanche, but.
Oh, that's okay. You can do a replay with this as well.
Okay, good.
Yeah. All of y'all who came in, don't worry. We're going to get this up for you for a replay. So yes. Okay. So I'm going to
Great questions.
Yeah, and we'll have another time. So if you have another one, don't worry. We're going to have a time at the end. But I just wanted to briefly go over. So Dr. Holly talked a lot about the role of the diaphragmatic breathing in this season. And I know for me, it took, even just when we were breathing just now, 3 deep breaths to realize I was clenching my bottom. I was like, oh, okay, release, Blanche. And that's just oftentimes where I hold tension. And so I often will pause, check in with myself, and then do 3 to 5 to 10 diaphragmatic breaths throughout the day. And it's really helpful. And so the second thing is really set intention and move with intention. I often work with pregnancy and postpartum clients with fitness. And so I have a saying of intention over intensity in this season. And so I just really kind of talk to them all the time about intention. And so we really want to move with intention, which basically means, are you moving with an alignment of your goal? So what is your goal for this season? And just moving in alignment with that. Just really, I'm going to stop this share because I like talking to them. But yeah, I think when we just randomly do a program, if we don't really know what kind of fitness to do, and then we just go on YouTube and just randomly click one, it could get us the hit of endorphins we want if your goal is just to like sweat, right? If you just want to sweat, you can do that. That's great. I would gently even ask like, well, why do you want to sweat? What about sweating makes you think that you're working out well, or that you had a really good workout? And again, there's no right or wrong answer, but just getting kind of to the deeper understandings of like why we're moving and what we want as a result, I think is really good. So yes, just really, really moving with intention. And so that's kind of like, I think for me in the last year, that's a huge shift that I've done. I have just stopped kind of like running myself ragged, and I've kind of shifted into moving with intention. And I've seen a lot of health, or just like growth even within my fitness, but then also my mental health and how I even perceive fitness and the mindset I have towards it as well. So I think there's just been a lot of growth, and it's been really cool to see. And the next thing is just recovering well is a great tip in this season, and how we recover well. It sounds really basic, but it's true. Make sure you get 7 to 8 hours of sleep, and make sure that we fuel our body well. It's more important than ever to recover well in this season because the general feeling is stressed, right? And so we want to de-stress, recover well, make sure we give our opportunities for our muscles to restore and rebuild. If we're going all the time, muscle grows whenever it's being rebuilt. And so we need time to recover that muscle so that it can get stronger. So yeah, did you want to add anything to that point, Dr. Holly?
No, I love that. I did have a thought on, you were talking about set intention.
Yeah.
And I think that that's a really important conversation because, you know, oftentimes we're told, listen to your body, you know, don't overdo it. These are sort of some common cues and things that are said to us. And at where it comes from is a great place, but like, what does that mean? Right. Listen to your body. Like, what are we listening for?
Right.
And so being sure that, you know, you know what you're listening for, and you know, that you're listening for pain, and that leaking when you're exercising is not, normal thing that happens postpartum. It's a very common thing that happens. It's not that, you know, you're not normal in that. It's very common, but knowing that there are resources out there that can help you.
It doesn't have to be.
Exactly. And, you know, heaviness and pressure and those sorts of things. And so just being, you know, careful when people say those terms, like just listen to your body, or whatever you were doing before, just keep doing that.
Yeah.
And being aware that that comes from a great place, but like, what does that even mean?
Yeah.
Listen to your body. And so again, I think that just plays off set your intentions as you're moving, and applying that in a sense of, how does it feel? Does it feel good? Does it not feel good? And then modifying or seeking out help as you're doing that, and giving yourself permission to try it in different ways. I also love what you said about the belief system. There's a really great PT, the Physio Detective, and he really challenges you in the sense of, like, what is your belief system around movement? And, you know, I think we get really stuck in, this is the right way to move and this is the wrong way to move, or and so giving yourself permission to feel like what feels good and what doesn't feel good, and play around with it, and give yourself permission to have fun with that, and try it in different ways, and that there's not necessarily like a right and a wrong way to move.
Yeah, for sure. Okay, we're gonna go quickly through the last few slides because I know I appreciate you all being with us this whole time. We ran over a little bit of the goal timeline, but man, we can talk about pelvic floors and fitness all night long. So just a good reminder to breathe. Okay, I did want to open it up. Does anybody have any questions on anything? I know we covered a lot of broad topics.
As it pertains to.
Yes,
I have a question.
Yeah.
So Dr. Holly, talking about pelvic floor being tight and low back pain. This might be a random question, but like how high can that back pain travel? I guess I'm just like, is it more like of a referral pain, or is it like literally something's like pulling on something?
Yeah. So there's different, it can be a referral. So oftentimes when I assess the pelvic floor intravaginally or interrectally, I can palpate a particular area of the pelvic floor. There's also a hip muscle in the pelvis that's right next to the pelvic floor called the obturator internus muscle. And that tends to be a muscle that will oftentimes refer to the low back. And then if you, again, think about sort of this connection of pelvis and diaphragm, that ties into the psoas muscle that sort of attaches into that lumbar spine. Thoracic spine can have a huge impact in the pelvis and our posture and our positioning. So that tension can definitely actually move all the way up into like headaches and jaw pain. I can't tell you how many people I treat their pelvic floor and they're like, I feel that in my jaw, because this is so connected, jaw to pelvis. And so when we're clenching our pelvic floor, we can also be clenching in our jaw here. That's oftentimes even at birth, right? They say, open your jaw, open your mouth, use sort of these low tone noises and vocalizations, and that can have an opening effect of the pelvis and the pelvic floor.
Oh, thank you.
Yeah.
Any other ones? By the way, even though it says Nicole by my name, I'm not Nicole, I'm Blanche. I'm using Nicole's account. So just if that was really confusing for anyone. Okay, so we're just going to briefly offer you to connect with us. These are my 3 boys.
Oh, sorry, Blanche.
Oh, yeah, go for it.
I don't know if y'all can hear me. My connection's not that great right now, but Dr. Holly, I was wondering, or have studied much on EDS?
Yeah.
Do these things, is there anything that would be particularly helpful? I don't know if I have EDS. My sister does, my mom, I think, does. So I possibly have some connective tissue issues. But I wondered, is there any tip or anything in all of this that would be helpful for someone who might have more of that propensity?
Yeah, definitely. So EDS, Ehlers-Danlos syndrome, it's a connective tissue disorder, oftentimes results in laxity of ligaments and joints, decrease in stability of certain areas, which then can also play into some tightness and tension in other parts of the body. Definitely, the diaphragmatic breathing is a great activity that so many people can benefit from, as well as my clients with EDS.
Okay.
So that can be very helpful, working and movement. And there are a number of great resources out there on movement for people with EDS. We can definitely talk more if you need additional information about sort of how to move. There are I do see a lot of clients with EDS for pelvic floor PT, and we do a lot of core strengthening and stability for the muscles that tend to be more relaxed, and then also lengthening and getting more flexibility in those muscles that tend to clamp down. But a great place to start is that diaphragmatic breath.
Okay, great. Yeah, I can always reach out to you maybe another time. And I've even thought, I already told Blanche, I need to go see her. This is before this happened anyway, this webinar. So
yeah, definitely. It's a diagnosis that's oftentimes not talked about, and there's a number of really wonderful resources out there.
Awesome, thank you.
Yeah, of course.
Does anybody else have a question? Okay, you can feel free to interrupt me too, because I think there might be a delay. Okay, so I'm gonna offer you to connect if any of this, you have questions that you maybe wanted to ask us, but you didn't have a chance or just wanna follow along with us. My social and Facebook, Instagram, all the socials, you can follow me along at Blanche Schuchardt. I also have a podcast that I just launched yesterday, which is awesome. The Blossom Strong podcast, We are still getting it on certain platforms, but there's a link in my bio that you can listen to it as well. And then just my email and website. So these are my 3 boys, and this guy is hilarious. I don't know if you can see my mouse, but he just cracks me up. This is Jonah and Gideon and Asher. Asher's turns a year in like 3 days, and then Gideon is 2.5 and Jonah's 4.5. Just so you know a little bit about my boys. So I wanted to just even briefly communicate about my services. So I actually have 2 online self-paced programs, Bump Fit and Mom Fit, as well as I have a ton of free Strong Mama fitness resources in my profile on my Instagram. So you can just click the link in my bio and follow that to where you can download some awesome free prenatal and postpartum fitness guides that kind of goes more into a lot of the stuff. And then diastasis and prolapse as well. Just great definitions and what they are, and really positive based communication about it, because I think there's a lot of fear mongering, whether it's unintentional or not. So if you want like a positive based approach, this is where you can find it. And then lastly, I'm going to be launching a Blossom Strong remote coaching. It's a small group coaching community that I'm launching May 1st. So if that interests you, you can always reach out to me. And Dr. Holly, this is
yeah, so I put my phone number on there. It's my business phone too. If you guys have questions or want to touch base, you can always shoot me a text or give me a call. We can set up a visit. And then that's also my website where you can check out Lotus Rehab here in San Antonio. Those are my 2 boys.
they're so cute.
Zeth and Teo.
Boy mom.
Yes, all the boys. And then what I offer, so I am a pelvic floor physical therapist. So I do one-on-one personalized assessments with my clients and come up with a treatment plan. I am an out-of-network provider, so I don't bill insurance. I am a cash practice. However, depending on out-of-network benefits, many of my clients are able to get reimbursement for those PT services. I feel like all pregnant and postpartum moms should get pelvic floor PT. It should just be our standard of care. Sometimes a misconception is thinking that you have to wait until postpartum to see a pelvic floor PT, but I do assessments for pregnant women as well, especially as it pertains to fitness and movement and what's happening in your pelvic floor as you're moving during those times and during those phases. And then recently, with everything that's gone on, I have launched some virtual telehealth physical therapy sessions where I can, discuss what's going on, do some assessment over the computer, and give you a one-on-one treatment plan from the comfort of your home with all of this COVID-19 going on. And then I am so passionate about doing free community workshops and providing this information in the community. Again, I am just passionate about empowering women. Just like you said, so much fear around movement and diastasis and pregnancy, and I see the pendulum swings one direction and then swings the other direction. So, providing just evidence-based factual information for women as it pertains to the pelvic floor, and just allowing people an opportunity to have that conversation and ask their questions, and really feel empowered in moving through these journeys, whether it be preconception, throughout pregnancy, postpartum, pelvic pain. And I oftentimes say even postpartum, I get so many people that are like, oh, I'm 20 years or 30 years postpartum. And I say, once postpartum, always postpartum. So.
For sure. And even just with the workshops, that leads us into just connecting with our collective, San Antonio Family Support. You can follow us on Facebook and look us up. I'm not sure. This is what I use. I don't know if we actually have the San Antonio Family Support Collective or if it's just San Antonio Support Collective. But this is our email. If you want a specific workshop, please reach out and email us at or it's really hard to, safscollective@gmail.com. And just let us know. We are here for you to support you in this time. And there's so many awesome workshops planned, from everything with pregnancy, birth, postpartum, how to transition with that well, mental health. I could go on and on. Kids fitness. It's going to be a lot of fun. So definitely connect with us there. And if y'all don't have any more questions, then that is the end of our official workshop.